Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 25 practice NCLEX questions. Without the way, let's get started.
Which of the following statements should indicate to the nurse that a client has understood the discharge instructions provided after nasal surgery? 1. I should not shower until my packing is removed. 2. I will take stool softeners and modify my diet to prevent constipation. 3. Coughing every 2 hours is important to prevent respiratory complications. 4. It is important to blow my nose each day to remove the dried secretions. The correct answer is 2. I will take stool softeners and modify my diet to prevent constipation. Constipation can cause straining during defecation, which can induce bleeding. Showering is not contraindicated. The client should take measures to prevent coughing, which can cause bleeding. The client should avoid blowing the nose for 48 hours after the packing is removed. Thereafter, the client should blow the nose gently, using the open mouth technique to minimize bleeding in the surgical area. A client has had surgery for a deviated nasal septum. Which of the following would indicate that bleeding was occurring even if the nasal drip pad remained dry and intact? 1. Nausea. 2. Repeated swallowing. 3. Increased respiratory rate. 4. Increased pain. The correct answer is 2. Repeated swallowing. Because of the dense nasal packing, bleeding may not be apparent through the nasal drip pad. Instead, the blood may run down the throat, causing the client to swallow frequently. The back of the throat, where the blood will be apparent, can be assessed with a flashlight. An accumulation of blood in the stomach can cause nausea and vomiting, but nausea would not be the initial indicator of bleeding. An increased respiratory rate occurs in shock, but is not an early sign of bleeding in a client who has undergone nasal surgery. Increased pain warrants further assessment, but is not an indicator of bleeding. Pseudoephedrine has been prescribed as a nasal decongestant. Which of the following is a possible adverse effect of this drug? 1. Constipation. 2. Bradycardia. 3. Diplopia. 4. Restlessness. The correct answer is 4. Restlessness. Adverse effects of pseudoephedrine are experienced primarily in the cardiovascular system and through sympathetic effects on the central nervous system. The most common CNS adverse effects include restlessness, dizziness, tension, anxiety, insomnia, and weakness. Common cardiovascular adverse effects include tachycardia, hypertension, palpitations, and arrhythmias. Constipation and diplopia are not adverse effects of pseudoephedrine. Tachycardia, not bradycardia, is an adverse effect of pseudoephedrine. A client with allergic rhinitis asks the nurse what to do to decrease the rhinorrhea. Which of the following instructions would be appropriate for the nurse to give the client? 1. Use your nasal decongestant spray regularly to help clear your nasal passages. 2. Ask the doctor for antibiotics. Antibiotics will help decrease the secretion. 3. It is important to increase your activity. A daily brisk walk will help promote drainage. 4. Keep a diary of when your symptoms occur. This can help you identify what precipitates your attacks. The correct answer is 4. Keep a diary of when your symptoms occur. This can help you identify what precipitates your attacks. It is important for clients with allergic rhinitis to determine the precipitating factors so that they can be avoided. Keeping a diary can help identify these triggers. Nasal decongestant sprays should not be used regularly because they can cause a rebound effect. Antibiotics are not appropriate for allergic rhinitis because an infection is not present. Increasing activity will not control the client's symptoms. In fact, walking outdoors may increase them if the client is allergic to pollen. The nurse teaches the client how to instill nose drops. Which of the following techniques is correct? 1. The client uses sterile technique when handling the dropper. 2. The client blows the nose gently before instilling drops. 3. The client uses a new dropper for each installation. 4. The client sits in a semi-Fowler's position with the head tilted forward after administration of the drops. The correct answer is 2. The client blows the nose gently before instilling drops. The client should blow the nose before instilling nose drops. Instilling nose drops is a clean technique. The dropper should be cleaned after each administration, but it does not need to be changed. The client should assume a position that will allow the medication to reach the desired area. This is usually a supine position. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is assigned to care for a client with a detached retina. Which finding should the nurse expect to be documented in the client's record? 1. Blurred vision. 2. Pain in the affected eye. 3. A yellow discoloration of the sclera. 4. A sense of a curtain falling across the field of vision. The correct answer is 4. A sense of a curtain falling across the field of vision. A characteristic clinical manifestation of retinal detachment described by clients is the feeling that a shadow or curtain is falling across the field of vision. There is no pain associated with detachment of the retina. A retinal detachment is an ophthalmic emergency, and even more so if visual acuity is still normal. Options 1 and 3 are not specifically associated with a detached retina. For a patient who has multiple risk factors for primary open-angle glaucoma, which sign or symptom should be investigated as an early sign of POAG? 1. Loss of central visual field. 2. Seeing halos around lights. 3. Mild eye aching. 4. Loss of peripheral vision. The correct answer is 3. Mild eye aching. POAG develops slowly, and irreversible damage to the optic nerve can occur before any signs or symptoms are manifested. However, mild eye aching or headaches should be investigated as possible early signs of POAG. Loss of peripheral vision, seeing halos, and loss of central vision are late signs. A patient has a hordeolum on the right upper eyelid. Which intervention would the nurse recommend first? 1. Apply warm compresses 4 times per day. 2. Gently perform hygienic eyelid scrubs. 3. Obtain a prescription for antibiotic drops. 4. Contact the ophthalmologist. The correct answer is 1. Apply warm compresses 4 times per day. Warm compresses usually provide relief. If the problem persists, eyelid scrubs and antibiotic drops would be appropriate. The ophthalmologist could be consulted, but other providers such as the family physician or the nurse practitioner could give a prescription for antibiotics. The clinic nurse is preparing to test the visual acuity of a client using a Snellen chart. Which of the following identifies the accurate procedure for this visual acuity test? 1. Both eyes are assessed together, followed by the assessment of the right and then the left eye. 2. The right eye is tested, followed by the left eye, and then both eyes are tested. 3. The client is asked to stand at 40 feet from the chart and is asked to read the largest line on the chart. 4. The client is asked to stand at 40 feet from the chart and to read the line that can be read 200 feet away by an individual with unimpaired vision. The correct answer is 2. The right eye is tested, followed by the left eye, and then both eyes are tested. Visual acuity is assessed in one eye at a time, and then in both eyes together, with the client comfortably standing or sitting. The right eye is tested with the left eye covered, then the left eye is tested with the right eye covered. Both eyes then are tested together. Visual acuity is measured with or without corrective lenses, and the client stands at a distance of 20 feet from the chart. A visual acuity test is only one part of a comprehensive ophthalmologic examination. The goal of the visual acuity test is to determine clarity or sharpness of vision. The nurse is reviewing prescriptions for several patients who have disorders of the eye. Which medication prescription is the most important to discuss with the healthcare provider? 1. Timolol for open-angle glaucoma. 2. Cromolyn sodium for allergic conjunctivitis. 3. Atropine for acute angle closure glaucoma. 4. Ranibizumab for wet age-related macular degeneration. The correct answer is 3. Atropine for acute angle closure glaucoma. Atropine should not be used for acute angle closure glaucoma. Atropine causes dilation of the pupil, which impedes outflow of aqueous humor and increases intraocular pressure. This action could precipitate or worsen the condition. The nurse has just received a change of shift report about these pediatric patients. Which patient will the nurse assess first? 1. A 1-year-old patient with hemophilia B who was admitted because of decreased responsiveness. 2. A 3-year-old patient with von Willebrand disease who has a dose of desmopressin scheduled. 3. A 7-year-old patient with acute lymphocytic leukemia who has chemotherapy-induced thrombocytopenia. 4. A 16-year-old patient with sickle cell disease who reports acute right lower quadrant abdominal pain. The correct answer is 1. A 1-year-old patient with hemophilia B who was admitted because of decreased responsiveness. Because decreased responsiveness in a 1-year-old patient with a clotting disorder may indicate intracerebral bleeding, this patient should be assessed immediately. The other patients also require assessments or interventions, but are not at immediate risk for life-threatening or disabling complications. The nurse is obtaining the history and physical information for a child who is recovering from Kawasaki disease and receives aspirin therapy. Which information concerns the nurse the most? 1. The child attends a daycare center 5 days a week. 2. The child's fingers have areas of peeling skin. 3. The child is very irritable and cries frequently. 4. The child has not received any immunizations. The correct answer is 4. The child has not received any immunizations. Children who receive aspirin therapy are at risk for the development of Reye syndrome if they contract viral illnesses such as varicella or influenza, so the lack of immunization is the greatest concern for this child. Peeling skin on the fingers and toes and irritability are consistent with Kawasaki disease, but do not require any change in therapy. Because Kawasaki disease is not a communicable disease, there is no risk for transmission to other children in the daycare. The nurse is observing a preschool classroom of children between the ages of 3 to 4 years of age. When planning actions to ensure that each child meets normal developmental goals, which child will require the most immediate intervention? 1. A 3-year-old boy who needs help dressing. 2. A 4-year-old girl who has an imaginary friend. 3. A 4-year-old girl who engages only in parallel play. 4. A 3-year-old boy who draws stick figures. The correct answer is 3. A 4-year-old girl who engages only in parallel play. At 4 years of age, children engage in pretend play. Parallel play is seen in younger children between the ages of 2 and 3 years when they play side by side with limited interaction. The other behaviors are developmentally appropriate. The nurse will plan interventions to ensure that all the children meet developmental goals, but the 4-year-old child engaging only in parallel play will require the most immediate intervention. The nurse is assisting with the delivery of a 31-week gestational age premature newborn who requires intubation for respiratory distress syndrome. Which medication does the nurse anticipate will be needed first for this infant? 1. Theophylline. 2. Surfactant. 3. Dexamethasone. 4. Albuterol. The correct answer is 2. Surfactant. Research indicates that the administration of synthetic surfactant improves respiratory status and decreases the incidence of pneumothorax in premature infants with RDS. The other medications may be used if respiratory distress persists, but the first medication administered will be the surfactant. The nurse has obtained this assessment information about a 3-year-old patient who has just returned to the pediatric unit after having a tonsillectomy. Which finding requires the most immediate follow-up? 1. Frequent swallowing. 2. Hypotonic bowel sounds. 3. Reports of a sore throat. 4. Heart rate of 112 beats per minute. The correct answer is 1. Frequent swallowing. Frequent swallowing after a tonsillectomy may indicate bleeding. The nurse should inspect the back of the throat for evidence of bleeding. The other assessment results are expected in a 3-year-old child after surgery. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The school nurse is performing developmental screenings for children who will be entering preschool. A 4-year-old girl excitedly tells the nurse about her recent birthday party. As she relates the details of the event, she frequently stutters. Which action by the nurse is most appropriate at this time? 1. Refer the child to an audiologist. 2. Obtain a detailed birth history from the parents. 3. Document the findings on the child's school record. 4. Refer the child to a speech pathologist. The correct answer is 3. Document the findings on the child's school record. Stuttering during the preschool years is a normal variation, particularly when excited or upset. The cause is attributed to preschool children increased cognitive abilities and imagination such that their speech cannot keep up with their thoughts. Documenting this on the child's record is important for continued observation to determine if it extends beyond the preschool years. While working in the pediatric clinic, the nurse receives a telephone call from the parent of a 13-year-old child who is receiving chemotherapy for leukemia. The patient's sibling has chickenpox. Which action will the nurse anticipate taking next? 1. Administer varicella-zoster immune globulin to the patient. 2. Teach the parent about the correct use of acyclovir. 3. Educate the parent about contact and airborne precautions. 4. Prepare to admit the patient to a private room in the hospital. The correct answer is 1. Administer varicella-zoster immune globulin to the patient. The administration of varicella-zoster immune globulin can prevent the development of varicella in immunosuppressed patients and will typically be prescribed. Acyclovir therapy and hospitalization may be required if the child develops a varicella-zoster virus infection. Contact and airborne precautions will be implemented to prevent the spread of infection to other children if the child is hospitalized with varicella. The nurse is obtaining the pulse of a client who had a femoral popliteal bypass surgery 6 hours ago. Which assessment provides the most accurate information about the client's post-operative status? 1. 2. 3. 4. The correct answer is option 4. The presence of a strong dorsalis pedis pulse indicates that there is circulation to the extremity distal to the surgery, indicating that the graft between the femoral and popliteal artery is allowing blood to circulate effectively. Option 1 shows the nurse obtaining the radial pulse. Option 2 shows the femoral pulse, which is proximal to the surgery site and will not indicate circulation distal to the surgery site. Option 3 shows the nurse obtaining an apical pulse. According to evidence-based guidelines from the American Optometric Association, which patient needs to have an annual eye examination? 1. 18-year-old who is asymptomatic and has low risk. 2. 40-year-old who is asymptomatic and has low risk. 3. 55-year-old who is asymptomatic and has low risk. 4. 67-year-old who is asymptomatic and has low risk. The correct answer is 4. 67-year-old who is asymptomatic and has low risk. People 65 years or older are advised to have eye examinations annually or even more frequently, even if they have low risk. People who are 18 to 64 years old with low risk are advised to have eye examinations at least every 2 years. Examples of risk factors include family history for eye disease, systemic health conditions that affect the eyes, such as diabetes, racial or ethnic backgrounds with increased risk, such as African Americans, occupations that are eye hazardous, prescription or non-prescription drugs with ocular side effects, contact lenses, previous eye surgery or eye injury, and having functional vision in only one eye. After cataract surgery, which symptom needs to be immediately reported to the healthcare provider? 1. A scratchy sensation in the operative eye. 2. Loss of depth perception with the patch in place. 3. Poor vision 6 to 8 hours after patch removal. 4. Pain not relieved by prescribed medication. The correct answer is 4. Pain not relieved by prescribed medication. Pain may signal hemorrhage, infection, or increased ocular pressure. A scratchy sensation and loss of depth perception with the patch in place are common. Adequate vision may not return for 24 hours. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which findings should be immediately reported to the healthcare provider? 1. A change in color vision. 2. Crusty yellow drainage on the eyelashes. 3. Increased lacrimation. 4. A curtain-like shadow across the visual field. The correct answer is 4. A curtain-like shadow across the visual field. A curtain-like shadow is a symptom of retinal detachment, which is an emergency situation. A change in color vision is a symptom of a cataract. Crusty drainage is associated with conjunctivitis. Increased lacrimation is associated with many eye irritants, such as allergies, contact lenses, or foreign bodies. A patient calls the clinic and reports redness of the sclera, itching of the eyes, and increased lacrimation for several hours. What should the nurse direct the caller to do first? 1. Please call your healthcare provider. 2. Apply a cool compress to your eyes. 3. If you are wearing contact lenses, remove them. 4. Take an over-the-counter antihistamine. The correct answer is 3. If you are wearing contact lenses, remove them. If the patient is wearing contact lenses, the lenses may be causing the symptoms, and removing them will prevent further eye irritation or damage. Policies on giving telephone advice vary among institutions, and knowledge of the facility policy is essential. The other options may be appropriate, but additional information is needed before suggesting anything else. According to evidence-based guidelines from the American Optometric Association, which modifiable risk factor is the most important to emphasize during patient teaching to reduce the risk for age-related macular degeneration? 1. Initiate smoking cessation. 2. Take vitamin D and E supplements. 3. Eat dark green, leafy vegetables. 4. Wear protective eyewear as needed. The correct answer is 1. Initiate smoking cessation. According to the American Optometric Association, smoking cessation is the most important modifiable factor for decreasing risk for age-related macular degeneration. Consumption of dark green vegetables and use of vitamin supplements are recommended, but the evidence is less compelling. Use of protective eyewear is recommended to prevent eye injuries during active sports or hazardous occupations, but this preventative measure is not related to age-related macular degeneration. The staff nurse is working with a student nurse to provide care for a 10-year-old patient with severe abdominal, hip, and knee pain caused by a sickle cell crisis. Which action taken by the student requires the staff nurse to intervene immediately? 1. Administering oral pain medication as needed. 2. Positioning cold packs on the child's knees. 3. Encouraging increased fluid intake. 4. Monitoring vital signs every 2 hours. The correct answer is 2. Positioning cold packs on the child's knees. Sickle cell crisis may include vaso-occlusive crisis, splenic sequestration, and aplastic crisis. The symptoms experienced by this child are indicative of both vaso-occlusive crisis and splenic sequestration. Placing cold packs on the knees of a child with vaso-occlusive crisis results in vasoconstriction, placing the child at risk for thrombosis formation. Encouraging increased fluid intake is advised to prevent thrombosis formation. Monitoring vital signs is a method to assess for life-threatening complications associated with both vaso-occlusive crisis and splenic sequestration. Vaso-occlusive crisis is associated with severe pain, and pain medication is recommended. After receiving the change of shift report, Which patient should the nurse assess first? 1. An 18-month-old patient with coarctation of the aorta who has decreased pedal pulses. 2. A 3-year-old patient with rheumatic fever who reports severe knee pain. 3. A 5-year-old patient with endocarditis who has crackles audible throughout both lungs. 4. An 8-year-old patient with Kawasaki disease who has a temperature of 102.2 degrees Fahrenheit. The correct answer is 3. A 5-year-old patient with endocarditis who has crackles audible throughout both lungs. Crackles throughout both lungs indicate that the child has severe left ventricular failure as a complication of endocarditis. Hypoxemia is likely, so the child needs rapid assessment of oxygen saturation, initiation of supplemental oxygen delivery, and administration of medications such as diuretics. The other children should also be assessed as quickly as possible, but they are not experiencing life-threatening complications of their medical diagnoses. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.